need to do a little finger stick to check your blood sugar. Okay, can you state your first and last name and your birthday? And I would have my MAR with me because I need to see that medical record number. All right. For this test, I need to prick one of your fingers. Which hand would you like me to use? The right one? Okay, so which finger have you been using all the fingers, or is there one that I can use? The index one? Okay, so we'll use this one. So I'm gonna bring my glucometer with me over here. All right, Mr. Ocampo, just relax for a minute. I am going to clean your finger first, and then you're going to feel a little stick because I have a needle here. I'm just going to stick your finger and get some blood. Okay, so we'll say that this is my alcohol swab and this is my gauze. Okay, because we have to have the gauze that day.
First three.
Yes. So we're going to take this out. Okay, Mr. Ocampo, just relax for me. All right, first I'm going to do is I'm going to clean. Okay, and then I'm going to hold your finger, just relax for me, and you're going to go down like this, and you're going to say click. Okay, Mr. Campbell, there you go. Okay, I'm cleaning out the first drop. The second drop is there, and you're just going to go. Okay, I got it. All right, I'm going to have you hold this gauze with your other finger, okay? Just put some pressure on it. And then this is gonna wind out to 5, right? 5, 4, 3, 2, 1 is gonna say beep. Okay, so on your sliding scale, pick a number. Pick a number and have it say, okay, my IQ check is 208. For 208, I need to, Mr. Ocampo, I need to go to my med room. I need to check my mark, and I'm gonna be back in a few minutes because I do believe with this number I have to give you some insulin, but I don't know what it is, so I'm gonna have to go check. So we're gonna clean up, and I'm gonna take this with me because I need to write it down because I'm gonna forget. And then you go to your Metro, you take this off. Actually, take it off in the trash because this doesn't go in the trash because it has blood, so it should go in there. Okay. All right, so you're ready. Okay, it's 208, remember? So you go to your Metro, and you're going to look at your mark. So, okay, for 208, I'm going to give, is this it? I'm just going to make up a number. For 208, I'm going to give 6 units. Okay, so you have your 6 units, you have your MPH, because it says to give MPH in the morning. Okay, so you have your MPH over here. I'll just say this is MPH because they're over there on that side. So your MPH is here, this is your regular. Okay, so remember, this is already in the Sharps dispenser, and this goes in the Sharps dispenser too, because it has a needle. All right, so I don't need this anymore. I'm going to put it back where it's supposed to be, and then you're going to clean. After you check for expiration date, make sure it's the right one. Okay, both the right one. Wash your hands. I don't need to put on gloves. Okay, I'm just going to wash my hands with sanitizer. And then I'm going to get some alcohol swabs. You need 2. You need 2 because we're not supposed to use the same one. All right, so open it up, and we're going to clean. This is your MPH. We're going to open this one up, and we're going to clean. All right, and I don't have a normal syringe, so I guess I'm just going to pick anything from here. So we're gonna put air in them, okay? Thank you. All right. So are we running out of these? No, we got plenty. Okay. All right. So remember, you're going to put in 14 of air to the MPH, okay? Okay, 14 of air. Take out, and I said we were going to give 8 units, right? Because my AccuCheck, I just made that up. It's probably not correct here because I was making it up in my head, but we're going to follow this one. All right, so we're going to 8 units of air. All right. Okay, we're going to push, and then I'm going to invert and drop. This has a lot of pressure in there. We've been putting a lot of air in here. All right, so I'm gonna turn this because it's in my way. Okay, so we're gonna go. I see a lot of air already, so I'm gonna push up because it went past 10.
We sold lemons with chili powder. You pay like a quarter.
Okay.
Half a lemon.
8. Now you need a witness. So state in that test that you're going to have a witness look at your insulin level, because you need to have 8. All right. So the witness says yes, there is 8 in there, and then she looked at your label, and then she's going to look at this label to make sure NPH and regular. And now I'm going to tell her that I'm going to draw up. So 8 and 14 is 22.
Yes.
So I'm going to draw up now a total of 22 units. Here's my NPH. Okay, you're going to invert. Okay, so I'm going to go to 22. But you're going to do it really slow. Do it slow, so hopefully we don't get a lot of air in it. Okay, I'm at 20, so I'm going to really super slow. $22. Okay, and that person's is gonna look at your syringe to see if it's 22. All right. So now I'm going to go back down and take it out, and now you're going to use the scoop method. And now I can help it. I don't need to have it really tight, just snug. And then I'm going to put my insulin back where I go. I'm going to go ahead and label this with the amount of units, the patient's last name, your number, the amount of units I'm going to give him. So I'm going to put a capital R for regular and NPH. Okay, a total of 22 units. Okay, so now I'm ready to go to my room. Okay, so you want to do it like that.
For subcutaneous, so ask again about which side is better for you.
Yes, I'm going to say, I have your insulin, Mr. Ocampo. I'm going to be giving you NPH and regular together. Where would you like me to administer the injection? Your abdomen? Okay, I'm just going to look at your abdomen. So I'm going to take off your blanket, and we're going to raise your gown here. Maybe just look at your abdomen first. Do you remember the last time you got insulin? Do you remember where in your abdomen did you get it? You don't remember? Okay, so let me just look. Okay, I'm looking at his skin. There's no redness, there's no bruising, and there's no break in the skin. So you're gonna say the abdominal skin sites are intact. There's no breakage in there. So since it's not written on my mark where you got it and you can't remember, I'm gonna go ahead and start my shift with giving you the insulin on the upper right quadrant. All right, and then next time I give him something, I'm gonna go over here, and then if I have to give him something for dinner, I'll go over here. And then that probably should be the end of my shift, and then when the report comes, I'll let him know that the last time I gave him insulin was on the left lower quadrant, and then they can start here, this way, okay? Okay, so I'm gonna go ahead and give it here, all right? So Mr. Ocampo, we're gonna go ahead and give your insulin here, and I'm going to tell you, I'm going to be bunching the skin. So you're going to feel like I'm gathering your skin, and we're going to make like a little bubble, and we're going to give it to you. And then in about 20 more minutes, your tray is going to come. And then I'll come and set you up for breakfast. So then I'm going to go over here because this is where we're giving it. Right? So this is your quadrant. I'm going to give it right here. Right? So my hands have been washed. I have my gloves on. All right, so then go ahead and start cleaning right here. These are really hard to clean because they're moving all the time. Okay, so we're gonna get larger and larger, and we're gonna give it a few minutes to dry. Okay, and then as it dries, okay, so we're gonna bunch the skin because we're gonna go at 90 degrees. All right, my needle looks crooked. Go down, and I can let go. I can just put my fingers there, and then we're gonna give it. Okay, I'm gonna count to 10 really fast. Okay, Mr. Ocampo, I'm gonna pull the needle out, and safety, and then just a little oozing there. Okay. All right, Mr. Ocampo. We gave you the insulin, and one of the things that insulin causes your blood sugar to go the opposite way, which means that if it's like in the 200, it may make it go down as low as in the 80s, 70s. So I'm going to come back in a few minutes, and I'm going to ask you to just tell me any symptoms that are not normal for you that you haven't felt. Okay. Some of the symptoms that you may feel as you may feel a little confused. Your speech may change a little bit, or you may have some dizziness, but you won't know that until you actually start walking. So we're gonna ask you some questions when I come back. All right? So just hold tight. Your tray's on the way, probably another 20 minutes. Okay, so now you're done, and you're gonna take this is recap, so I don't have to worry. It's gonna go in your sharp. This can go in the trash. This can go in the trash, and then I'm gonna take my sponge back to my med room. Okay?
After this, when the patient can eat breakfast?
So you gave it at 7:30. Probably the trays may be there like around 8:10.
Okay, after
Yeah.
half hour or 1 hour.
Yes, not 1 hour. It should be only a half an hour because you have regular insulin here, and that's gonna act fast.
Fast, yes.
Okay, so if your tray didn't come, get him a snack from your kitchen, and then call the kitchen to see what happened.
Okay.
These trays are not here.
Okay. Thank you.
All right. See, just practice at home. Pretend your pillow is your patient.
Okay.
All right.
Thank you.